Let's put your hematology knowledge to the test. Ready? In this trivia challenge, we'll cover 4 key areas: blood cell physiology, laboratory interpretation, blood disorders, and hematology pharmacology. Each area includes 3 questions: 1 easy, 1 medium, and 1 hard, worth 1, 2, or 3 stars. You'll have a moment to think before we reveal the correct answer, along with a short explanation from Lecturio's medical content. Keep score as you go and discover how strong your foundation in hematology really is. Let's get started. What does the buffy coat primarily contain?
There is this very, very tiny layer called the buffy coat. That's only less than 1% of total blood volume. That little buffy coat contains the white blood cells and platelets. Very small proportion of blood, but those white cells, as we will see later on, are very, very important because they're involved with protecting our body against invading pathogens.
What is the main function of red blood cells?
Now, red cells are packed with hemoglobin and they carry oxygen to tissue.
Hematopoiesis includes the formation of which 3 major blood components?
Hematopoiesis includes formation of the red blood cells, the white blood cells, and also the thrombocytes or platelets.
What does hematocrit refer to?
Sometimes hematologists will measure the percentage of total blood volume that's occupied by erythrocytes. Here it's about 45%. But it varies. It varies depending on whether you're a male or a female. Also, it varies depending on whether or not you may have some diseases of blood, such as anemia, where the proportion of red blood cells is decreased. It gets very low. And that's called the hematocrit. The hematocrit is the percent of total blood.
How are red blood cells with an MCV below 80 femtoliters classified?
Because as you'll see, the size of a red cell is a very useful clue in determining the cause of diseases, particularly anemia. The volume of a red cell is in this measurement called femtoliters, and normally it's around 80 to 95. If the red cell's small, less than 80, we call it microcytic. If it's large, over 95 is one reasonable cutoff, call it macrocytic. And that's very characteristic of different types of anemia.
Which finding would make leukemia more likely on a CBC?
For patients with aplastic anemia, the differential percentages of a CBC report are more likely to be normal, such as 65% neutrophils, 25% lymphs, etc. Whereas in a CBC report for leukemia, we'd expect abnormal cells and blasts, skewed percentages, and a left shift, or immature forms. The pancytopenia is moderate but proportional. The white blood cells are low but not severely, around 4.1. Platelets are low but not critically low, at 85. RBC indices, the MCV, MCH, MCHC, show normal cell development, where in leukemia it often shows abnormal RBC morphology with altered indices. Her white blood cell count is low, but in leukemia, it's often very high, and when it's low, it is really low.
What are the primary causes of the symptoms of acute leukemia?
The symptoms in acute leukemia are due to bone marrow failure. This results in decreased production of normal blood cells, leading to anemia, thrombocytopenia, and leukopenia. I would like to point out that although the white blood cell count is high, these cells represent the immature circulating blasts. So even though there is an increase in the number of circulating leukocytes, there is functional leukopenia because these cells do not function properly.
Which two major disorders are associated with microcytic red cells?
Microcytic red cells are seen in two major disorders. That's a key point to remember. Two major diagnoses, of which iron deficiency is the more common. Thalassemia is the other major disorder, and that's an imbalance in the production of the globin chains, alpha and beta.
Why can anemia occur even when the RBC count is not significantly decreased?
First, anemia. Who's your patient? Feeling fatigued and tired. Why is that? Well, for the most part, it's because of decreased hemoglobin. That should be your focus here in the first bullet point. Hemoglobin, by definition, when decreased, automatically puts you in the realm of anemia. Along with this, oftentimes you will find decrease in total number of RBCs, even though that is not a guarantee, and the circulating RBC mass is usually decreased as well.
Which anticoagulant must be administered by injection rather than orally?
Heparin is very widely used in modern medicine. It's a mucopolysaccharide, but it can't be orally ingested and therefore has to be injected either intravenously or subcutaneously. And its activity is to increase antithrombin activity. Antithrombin is not only active against thrombin itself, but a range of coagulation factors as an important anticoagulant.
Which pair of medications specifically block the ADP receptor on platelets?
So there are drugs that will block that ADP-ADP receptor interaction, clopidogrel and ticlopidine, and these are very commonly used to inhibit platelet activity.
Which medication is required for lifelong anticoagulation in a patient with a mechanical heart valve?
But also, patients who've had heart valves, particularly older heart valves, which were mechanical, they need warfarin for life. And warfarin was a key factor in leading to the success of cardiac operations.
And that's it for today's quiz. Let us know in the comments how many stars you earned. No matter your level, keep strengthening your expertise with Lecturio, your all-in-one study companion for success in clinical practice. Drop your score in the comments and let us know which area you want us to quiz you on next.